Procalcitonin guided use of antibiotics for lower respiratory tract infections. Definition: Procalcitonin, precursor of calcitonin, lower respiratory tract infections are often treated with antibiotics with evidence of clinically relevant bacterial disease. Serum calcitonin precursors concentrations, including procalcitonin, are raised in bacterial infections.
Lower respiratory tract infections. Overview. Lower respiratory tract infection or LRTI is an acute infection of the trachea or windpipe, airways and lungs which make up the lower respiratory system. Lower respiratory tract infections include bronchitis, bronchiolitis, croup or laryngotracheobronchitis and pneumonia. Symptoms. Main symptom is severe cough with phlegm and mucus. Sometimes the mucus may be blood-stained. Other symptoms of a lower respiratory tract infection include a tight feeling in your chest, breathlessness, wheezing, sore throat, headaches, chills and fever, aches and pains, irritability and lethargy, vomiting along with cough, blocked nose and sinuses. Causes. These infections are caused by bacteria, viruses or fungi. Viruses causing respiratory infections are highly contagious and they disperse readily via direct contact. Recovery time. Symptoms of lower respiratory tract infection usually resolve without specific treatment or investigation in a median of 3 weeks. Food and nutrition. Foods to be taken. Foods rich in vitamin C and E and minerals like zinc and selenium are good for respiratory infections. The vegetables that have the highest value of vitamin C are peppers, cauliflower, watercress, tomatoes, cabbage, peas, broccoli, potato skin and spinach. Fruits high in vitamin C like limes, grapefruits, strawberries, melons, kiwi, oranges, guava, papaya, mango and tangerines. Foods rich in vitamin E include sunflower seeds, peanuts, hazelnuts and almonds. Fish have the highest amount of vitamin E, especially sardines, tuna and salmon. Nuts, fish, wheat, rice, oats, peanuts, etc. have high amounts of zinc and selenium. Avoid foods that weaken the immune system. Refined and processed foods, dairy and high-fat products, sugar and high-sugar products, alcohol and tobacco products. Exercise and yoga. Do deep breathing exercises. Yoga and pranayama will improve the overall functioning of the respiratory tract and alleviates the symptoms of breathlessness. Call a doctor if you feel very weak, are unable to breathe properly, have severe cough along with mucus and phlegm, and have chest pain. Prevention. Get vaccinated with influenza vaccine yearly. Quit smoking as smoking damages lungs. Maintain hygienic conditions. Follow a healthy diet. Avoid foods rich in fats. Washing your hands regularly and thoroughly, particularly after touching your nose or mouth and before handling food. Sneezing and coughing into tissues. Throw away tissues immediately before washing your hands and do not share any things used by infected persons.
Applications in medicine. 243 patients admitted with suspect lower respiratory tract infections were randomly assigned standard procalcitonin guided treatment.
Roche Diagnostics, a leader in vitro diagnostic testing, is bringing the first fully integrated procalcitonin test to the U.S. market, the Alexis Brahms PCT test. In as little as 18 minutes, the test will measure the blood level of procalcitonin. Why is this important? Often, measuring organ failure using lactate levels is used to identify sepsis. However, lactate would not appear until the later stages of sepsis and will not indicate the underlying bacterial cause of infection. Bacteria is the major cause of the systemic infection in sepsis patients. As the bacterial infection continues to spread in the body, procalcitonin levels will rise, confirming the bacterial source of the infection. Measuring procalcitonin on the first day of admission will provide insight into the risk of progression through the stages of sepsis. In addition, to gain insight into the mortality risk of the patient, you can compare the levels of procalcitonin from the first day test to a test on the fourth day of their hospitalization. The comparison can indicate the effectiveness of sepsis management and help guide any necessary changes in patient management. What does this look like? For example, Mrs. Jones is admitted with suspected sepsis, and the first PCT test is administered. PCT levels will confirm a bacterial infection and give the physician early and reliable information to better understand the patient's sepsis state and effectively manage the infection with an appropriate treatment protocol. As the patient receives continued care in the hospital, it is recommended that a second test be administered on day 4 to assess their mortality risk and make appropriate clinical decisions. For example, if the day 0 level was 10 and the day 4 is 1, that is a 90% decline of procalcitonin levels over 4 days. This decline is indicative of significantly reduced mortality risk, providing the healthcare professional with the confidence to guide any changes to the patient's treatment. For example, with reduced mortality risk, Mrs. Jones could now be moved from a critical care setting to a general ward, possibly resulting in better patient management and significant cost savings. Alternatively, based on declining PCT levels, the healthcare professional could safely de-escalate the antibiotic treatment, resulting in appropriate usage of antibiotics and preventing potentially adverse outcomes. As a healthcare professional or laboratorian, wouldn't you want to communicate a more accurate prognosis to your patients? And wouldn't you want a faster way of knowing the risk of sepsis in your patient so you can confidently make timely management choices? Because even a correct decision is wrong when it is too late. With the Roche Alexis Brahms PCT test, it's time to win the fight against sepsis. Contact your Roche representative or call 1-800-346-8606. To learn more about
Pros: highly sensitive immunoassays address confounding factors, no exclusion, comparison with RCT Prohub.
Diagnostic value of procalcitonin in predicting bacteremia in intensive care unit. By Demirtal via Indian Journal of Critical Care Medicine, 2018 to 22 2. Demirtal, Pina Ursen, Salahadakan Nemle. Indian Journal of Critical Care Medicine 2018 22 2, 7884. Background and aims. Several biomarkers are used in the diagnosis of bacteremia. Procalcitonin, PCT, is more specific than other biomarkers in differentiating bacterial and non-bacterial inflammation. It was aimed to evaluate the diagnostic and prognostic value of PCT in bacteremic patients in intensive care unit, ICU. Materials and methods. A total of 156 patients diagnosed with non-infectious systemic inflammatory response syndrome, sepsis, and severe sepsis, septic shock in ICU between December 2014 and July 2015 were evaluated in this prospective cohort study. Results. The study group consisted of 41% bacteremic patients, and the control group consisted of 59% non-bacteremic patients. The overall mortality rate was 60.3%. Although PCT levels in the bacteremic group, 11.9 plus minus 21.5 nanograms/dl, were higher than non-bacteremic group, 5.9 plus minus 11.5 nanograms/dl. This difference was not significant, p equals 0.168. The mean levels of PCT in bacteremic patients with gram-negative bacteria were 16.3 plus minus 27.6 nanograms/dl, whereas gram-positive bacteria were 7.3 plus minus 10.7 nanograms/dl, p equals 0.145. The mean PCT levels were significantly higher in non-survivors compared to survivors, 10.1 plus minus 18.0 versus 5.7 plus minus 13.7 nanograms/dl, p0.
Cons. Low compliance experience center used diverse antibiotic prescribing, weekly emails for improvement.
My name is Eric Luck. I am the Director of Critical Care Services at Swedish Covenant Hospital in Chicago, Illinois. Bacterial infections are serious life-threatening illnesses. They need to be identified rapidly and accurately. Studies have shown that the earlier that we start appropriate therapy for infectious diseases, the better the outcome. What has been a problem over the last 3 decades has been the lack of sensitivity and specificity of the diagnostic tests that we had available to us. Culture results are often negative, even when the patient is overtly infected. White counts are unreliable. Fever curves are often not interpretable. We have been looking for other means of identifying infections. PROCALCITONIN has come to our aid. It's highly specific, very sensitive, and available in a timely fashion. It has really changed the landscape for both the identification of patients who are infected and for the identification of patients who are not infected. It is a highly specific response to bacterial infections, inhibited in fact by viral infections, and therefore really aids the clinician both in its kinetics and its specificity in identifying those patients who have bacterial infections and those patients who do not. When there's a bacterial infection, the levels increase. They increase proportionately to the severity of the infection, and therefore gives the clinician information about the presence of a bacterial infection and severity as information as well. From the onset of infection to the release of the procalcitonin is somewhere between 4 and 6 hours. As the stimulation continues, the procalcitonin levels will continue to rise, and they will continue to rise until effective therapy is given to the patient, at which point in time they will stop increasing and typically have a decline of about 50% per day. So the half-life is about 24 hours. There is a delay between the stimulation and the release of about 4 to 6 hours, which gives us a unique property such that when the patient presents,
Issue applied in Ecuador. From November of 2014 throughout May of 2017, a total of 1664 patients were enrolled and underwent randomization. 8 request withdrawal, leaving a final analysis cohort of 1656 patients. Baseline characteristics were similar among patients for whom complete 30-day data were available and those with incomplete data, as well as in the 2 treatment groups. Conclusion. The provision of procalcitonin essay result, along with instructions on their interpretation to emergency department and hospital-based clinicians, did usual care among patients with suspect lower respiratory tract infections.
I'm Dr. Anwar from IMD Medical Center, and I approve this message. A good way to tell if you have respiratory tract infection are some common things that may be wrong with your body, such as a runny nose, an itchy or sore throat, or even a severe headache. You may be wondering, how did I get this infection? I don't think I've done anything wrong. Well, you might have just been at the wrong place at the wrong time. See, respiratory tract infection can be caused by a series of things. One thing can be an airborne pathogen that might have been gone into your system through your nose or your mouth or even your eyelids. But bacteria-wise, if you have touched something that has bacteria and later that day you might have touched your mouth or your nose or even in or outer eyelids, this might have caused the bacteria spreading all the way into your throat, causing respiratory tract infection. You may be wondering, how did I get this infection? How was my body immune system lowered? It could be caused by a lack of sleep, overworking oneself, or even a high stress level. A good way of combating the infection is an intake of vitamin C. Natural is better. What you want to take naturally is citrus fruits. Citrus fruits include tangerines, oranges, limes, lemons, even grapefruits. If you are stripped of these means, you can always go to the store and buy an over-the-counter vitamin C tablet. I recommend you take 500 milligrams 3 times a day. Another means of fighting this infection is by gargling warm salt water or a saline solution. What you want to do is gargle this warm water before and after a meal, because when you eat food, this goes down in through your throat, maybe touching the infection, and can be transferred as a catalyst through your esophagus into your stomach. If the headache continues, I recommend you go to the store and buy some Tylenol.